types of planes that we have. First, we have the coronal or the frontal plane, and that's a vertical plane at a right angle to the cerebral axis, and you can see that plane here. And then if you go at a right angle to that, of course, we have the sagittal plane, which is a vertical plane, but it's parallel to the cerebral axis, and you can see that plane over here. Now we have a mid-sagittal plane, which means it goes through the midline, and you can see that plane over here in red. And then we have a parasagittal plane, which is just off the midline. So, for example, a parasagittal plane would go through, instead of the midline, let's say it goes through right about here. And that continues down, just like the mid-sagittal plane, but instead of going through the midline, it's just off the midline. So that's parasagittal. Then we have the horizontal plane or the transverse plane, which is parallel to the floor. Now let's look at some location terms in terms of spatial relationships between two parts of the body. If we're talking about something that's superior, that means it's above another part. If it's inferior, which would be the exact opposite, that means it's below another part. And then we have terms like rostral, which means towards the head. And this is when we're looking at general anatomy, assuming that we're talking about beneath the brain, beneath the head. So rostral is towards the head, and caudal would be toward the tail or the coccyx. So in other words, it's the opposite of rostral. And then we have anterior, that's towards the front, or ventral is also towards the front. And then we have posterior or dorsal, and that's towards the back. So anterior and posterior are opposite. Dorsal and ventral are opposite terms also. We have a few more to go over, and that would be medial, which is towards the midline, and lateral, which is farther away from the midline, as you can see here. Then we have proximal, which is nearest to the point of origin, so it's closer to something. And distal means farther from the point of origin, so it's farther away from whatever that point of origin is. That's not illustrated in the picture over here, but I'm sure you get the point. Then we have ipsilateral, which is on the same side of the body, and the opposite of that would be contralateral, which is on the opposite side of the body. So for example, if we're looking at the right leg, so here we have the right leg, the ipsilateral arm would be the right arm. The contralateral arm, of course, would be the left arm. So ipsilateral means it's on the same side. Contralateral means it's on the opposite side of the body. Now, the interesting thing about these directions is what happens when the spinal cord enters the cranium and we get the brain. Because beneath the brain, or beneath the head, we said that rostral was towards the head and caudal was away from the head. Ventral or anterior is the front of the body. Dorsal or posterior is towards the back of the body. Now, when we get into the brain and we pass the midbrain region, which is this region over here, what happens is that there's approximately 100-degree bend. So in other words, it comes and it bends in that direction. And what we have then is dorsal being the top of the brain and ventral being towards the bottom of the brain, rostral being towards the front, rostral or anterior, caudal being towards the back, or posterior being towards the back of the brain. And so you can see we have this shift. Instead of dorsal, ventral being towards the back and towards the front when we're beneath the brain, as we pass the midbrain region, dorsal now shifts to the top of the brain and ventral towards the bottom of the brain. So the ventral surface of the brain would be this surface here. The dorsal surface of the brain would be towards this surface. Caudal surface or the posterior surface of the brain would be this end, and the rostral or anterior surface of the brain would be towards this part here. Another way of looking at this is by looking at these little diagrams over here where we have rostral, caudal, ventral, and dorsal. But when we get above the brain, it's a little different. It shifts. Rostral is no longer going towards the top, but now that's going towards the front. Caudal towards the back, dorsal towards the top, and ventral towards the bottom of the brain. However, when it comes to superior and inferior, that stays the same. Superior means towards the top of the brain. Inferior means towards the tail or coccyx. So in other words, going towards the bottom. Anterior is always front, and posterior is behind.